I need you to stop whatever you are doing for the next few minutes, because what I am about to walk you through could literally change your monthly income and your healthcare costs starting right now. Not someday, right now. And the reason most seniors have no idea about any of this is not because it was hidden exactly. It was announced. It was published on government websites. But it was buried under headlines that most people scrolled right past without understanding what it actually means for their wallet, their benefits, and their daily life. So today, right here on Retirees with Linda, we are going to break all of it down together. Plain English, real numbers, no games. And if you are new here, welcome. This channel exists for one reason: to make sure you actually understand what is happening with your Social Security, your Medicare, and your retirement money. Because nobody else is going to sit down and explain it to you the way we do here. So hit that subscribe button right now and turn on notifications so you never miss a video like this one. Because today, we are covering something that touches every single senior in America. Here is the big picture. Between late 2024 and right now in 2026, the United States government passed some of the most significant changes to Social Security and Medicare in decades. We are talking about a law that restored benefits for nearly 3 million Americans who had been quietly shortchanged for 40 years. We are talking about a cost of living raise that just kicked in this January. We are talking about Medicare premiums jumping in a way that could eat into that raise before you even see it. And we are talking about things you need to do, actual steps you can take right now to make sure you are not leaving money on the table. So let us start at the beginning, with the story that, honestly, should have been front-page news for months. If you are a retired teacher, a former police officer, a firefighter, a federal employee under the old civil service system, a postal worker, or anyone who spent part of their career in a public sector job that did not pay into Social Security, then you need to lean in close right now. Because for 40 years, something called the windfall elimination provision and something else called the government pension offset were silently reducing or completely wiping out the Social Security benefits that millions of public servants had rightfully earned. And most of the people affected did not even fully understand why their checks were smaller than they should have been. Here is how this worked. If you spent part of your career in a government job with its own pension system, and then worked other jobs where you did pay into Social Security, the government had a formula that reduced what you received from Social Security because you also had that pension. The logic behind it was never entirely fair to begin with, but for decades, that is just the way it was. And then there was the government pension offset, which was arguably even worse. It reduced the Social Security spousal and survivor benefits for husbands and wives of public workers. It reduced those benefits by 2/3 of the pension amount. In many cases, it wiped them out entirely. A widow or widower of a retired teacher could end up with absolutely zero in Social Security survivor benefits, even though their spouse had paid into the system during years of other work. That is not a technicality. That is a real person sitting at a kitchen table with no income they were counting on. On January 5th of 2025, President Biden signed the Social Security Fairness Act into law. Both of those provisions, the windfall elimination provision and the government pension offset, were repealed. Gone. Permanently eliminated. And this was not a close vote either. The House passed it 327 to 75. The Senate passed it 70 to 26. This was one of the most bipartisan pieces of legislation in recent memory, because at the end of the day, the basic unfairness of these rules was impossible to defend. You worked. You contributed. You deserved what you earned. Now here's where it gets very real and very practical. The Social Security Administration has already been sending out the money. As of July of 2025, the SSA had completed sending out over 3.1 million payments, totaling $17 billion to eligible beneficiaries. And they did it 5 months ahead of schedule. Many of those affected began seeing their new, higher monthly benefit amount back in April of 2025. And on top of the higher monthly check going forward, affected beneficiaries received a lump sum retroactive payment covering the increase back to January of 2024, the month the old rules stopped applying. The average increase for people affected by the old windfall elimination provision was around $350 per month. And for surviving spouses who had their benefits slashed or completely eliminated by the government pension offset, some are now receiving between $800 and $1,600 a month that they were previously getting zero of. Think about what that means for a widow in her 70s who has been scraping by, not knowing she was entitled to that money. Now, if you are sitting there wondering whether this applies to you or someone you love, here is a simple way to think about it. Were you, or is someone in your family, a retired teacher in a state with its own pension system, like California, Texas, or Ohio? Were you a firefighter, a police officer, a federal employee under the civil service retirement system, or any state or local government worker in a state that did not participate in Social Security? If the answer is yes, there is a very real chance this law affects your benefits. And if you were previously told you did not qualify for Social Security spousal or survivor benefits because of the government pension offset, you need to revisit that right now, because the rules have changed completely. The most important thing to know is that for most people who were already receiving benefits, the Social Security Administration has been handling this automatically. You do not have to file a new application if you were already getting Social Security payments that were reduced by WEP or GPO. Your benefits should have already been recalculated, and you should have already received that retroactive payment. However, if you never applied for Social Security at all because you knew the WEP or GPO rules would have wiped out your benefit entirely, or if you never applied for spousal or survivor benefits for the same reason, then you do need to take action now. You need to go to ssa.gov or call 1-800-772-1213 and apply, because the SSA cannot give you what you have not applied for. And here's something I want to say clearly before we move on, because there are people out there right now trying to exploit this law to scam seniors. If someone calls you, emails you, or contacts you in any way claiming they can help you get your new Social Security Fairness Act payments faster, or that you need to pay a fee to receive your retroactive money, hang up. Block them. That is a scam, full stop. The SSA processes everything automatically at no cost to you. No one legitimate is going to ask you for money to unlock your own benefits. Now, let us talk about the 2026 cost of living adjustment, because even though this is something that happens every year, this year there are layers to it that most seniors are not seeing clearly, and they are costing people real money. Social Security benefits increased by 2.8% in January of 2026. For the average retiree, that works out to about $56 more per month, bringing the average monthly retirement check from around $2,015 to around $2,071. If you are a married couple both receiving benefits, you are looking at an average increase of about $88 a month. That money started showing up in January 2026 payments automatically. So if you are already collecting, it is already in your check. Now, $56 a month sounds good on paper. But here is where we need to have an honest conversation, because Medicare Part B premiums also went up this January, and they went up significantly. The standard monthly Part B premium climbed from $185 in 2025 to $202.90 in 2026. That is an increase of nearly $18 per month, and it was the second highest premium increase in the program's history. When you do the math, that $18 premium increase eats up roughly a third of the $56 raise that the COLA just gave you. So the net gain for a typical single retiree, once you subtract the premium increase, is closer to $38 per month, not $56. Now, $38 is still money, but I want you to understand the full picture because many seniors open their January statement expecting to see a much larger increase, and when they do not, they think something is wrong. Nothing is wrong. That is just the Medicare deduction doing its thing, quietly trimming your raise before it hits your pocket. There is also an important protection you should know about called the hold harmless provision. Under this rule, your Medicare Part B premium increase cannot exceed your Social Security COLA increase, which means the premium hike cannot completely wipe out your raise. However, this protection does not apply to everyone. If you are a new Medicare enrollee starting in 2026, if you pay your Medicare premium directly rather than having it deducted from your Social Security, or if you are in a higher income bracket and pay an income-related premium, you may not be protected by hold harmless. So it is worth checking where you stand. Beyond the Part B premium, Medicare Part B also comes with a higher deductible in 2026. The annual deductible went up to $283, which is $26 more than it was in 2025. And the Part A deductible, which applies to inpatient hospital stays, climbed to $1,736, up $60. These are not premium costs. These are out-of-pocket costs you face when you actually use your coverage. So they matter a great deal if you have any planned procedures, surgeries, or hospital stays coming up this year. And if you are on Medicare Part D for your prescriptions, there are changes there too. The maximum Part D deductible is now $615 for 2026, up from $590 in 2025. That said, one piece of genuinely good news on the prescription side is that insulin remains capped at $35 a month, and adult vaccines including flu, shingles, and pneumonia continue to be free under Medicare. Those are meaningful protections that are easy to forget to take advantage of. Here is a move that many seniors have already missed, but that you still have options for. Medicare Advantage open enrollment runs from January 1st through March 31st each year, and that window is open right now in 2026. If you are currently in an Advantage plan and you are not happy with your coverage, your network, or your drug costs, you can switch to a different Advantage plan or move back to original Medicare during this period. The annual open enrollment for all Medicare options happens in the fall, October 15th through December 7th, and that is typically the best time for a full review of your coverage. But if you missed that window and you're in a plan that is not working for you, do not just sit on it. Call 1-800-MEDICARE and find out what your options are right now. One more thing on the Medicare side that does not get nearly enough attention: Medigap, also called Medicare Supplement Insurance. If you are on original Medicare and you do not have a supplemental plan covering the gaps, those deductibles and co-insurance costs we just talked about fall directly on you. For some people, a Medigap plan more than pays for itself in reduced out-of-pocket exposure. It is worth at least having a conversation with your state health insurance assistance program, which is completely free, completely unbiased, and available in every single state. You can find yours at shiphelp.org. These counselors do not sell anything, and they have no financial stake in what they recommend. They are just there to help you understand your options. Now let us talk about full retirement age for a moment, because this is something that affects people who are approaching retirement and have not yet claimed Social Security. And it affects more people every year. If you were born in 1960 or later, your full retirement age is now 67. That is official as of 2026. That is the final step in a gradual increase that has been scheduled since 1983, and it is now complete. What that means practically is this. If you claim Social Security at 62, the earliest age you can claim, your benefit will be permanently reduced compared to waiting. On the other hand, if you wait past your full retirement age of 67, your benefit grows by 8% for every additional year you delay, all the way up to age 70. After 70, there is no additional benefit to waiting. So the window between 67 and 70 is where that delayed retirement credit really compounds. Whether waiting makes sense for you depends on your health, your financial situation, and your plans. And a good financial advisor or your local SHIP counselor can help you run those numbers for your specific situation. And there is one more change that could affect you or someone in your family, even if they are still working. The Social Security wage cap, which is the maximum amount of income that gets taxed for Social Security, went up to $184,500 in 2026. If you are still working and earning above that threshold, your Social Security taxes stop once you hit that ceiling for the year. But for most working seniors who are earning below that level, this change does not directly affect your paycheck. What it does affect is the long-term funding picture for Social Security, because more contributions are coming into the system from higher earners. Speaking of the long-term picture, I would be doing you a disservice if I did not mention this. The most recent projections from the Congressional Budget Office, published in early 2026, show that Social Security's trust fund is on a trajectory that, if nothing changes, could result in a significant benefit cut by around 2033. We are talking about a potential reduction of roughly 23% for future beneficiaries if Congress does not act to shore up the system. Now, that does not mean it is going to happen. Congress has intervened before. But it is a number you should be aware of, especially if you are a few years away from claiming and trying to plan your retirement income. The longer Congress waits to address it, the more dramatic the eventual fix will likely need to be. That is why staying informed and staying engaged matters, not just for you personally, but for the broader conversation about what our country owes the people who built it, paid into it, and are now counting on it. So let us bring this all together with the things you need to actually do, not someday, this week. First, if you or someone in your family worked in a public sector job that had its own pension and was not covered by Social Security, go to ssa.gov right now and look up the Social Security Fairness Act page. Check whether you are among the 3.1 million people who should have already received an increased monthly benefit and a retroactive payment. If you believe you were affected but have not received anything, call the SSA directly at 1-800-772-1213. If you were previously talked out of applying for Social Security or spousal survivor benefits because of WEP or GPO, apply now because the rules that blocked you are gone. Second, log into your My Social Security account at ssa.gov and verify that your January 2026 benefit statement reflects the 2.8% COLA increase. While you are in there, check your earnings history for any errors, because mistakes in your earnings record can reduce your benefit, and most people never catch them. Third, call 1-800-MEDICARE or visit medicare.gov to review your current coverage and understand exactly what your 2026 premiums and deductibles are. If you have a Medicare Advantage plan, this is your last chance until fall to make a switch, if it is not serving you well, because the open enrollment period ends March 31st. Fourth, find your local SHIP counselor at shiphelp.org and schedule a free consultation. Bring your Medicare card, your Social Security statement, any notices you have received about your 2026 benefits, and a list of your prescriptions. These counselors can spot things that most people miss, and they have helped countless seniors find coverage options and benefits they had no idea they were entitled to. Fifth, and I cannot say this strongly enough, be extremely cautious of any unsolicited contact related to these benefit changes. Scammers are actively calling seniors right now, pretending to be from the Social Security Administration or Medicare, referencing these exact changes to sound credible and asking for personal information or processing fees. Real government agencies do not work that way. The SSA will never call you demanding immediate action. Medicare will never ask for your bank information over the phone. If you did not initiate the call, do not give them anything. Hang up and call the official number yourself. Now I want to take a moment and talk to you directly, not just as a viewer, but as a person. Because behind all these numbers and policy changes and government acronyms, there are real lives. There are real people who worked for 30, 40 years, paid into a system, trusted that the system would be there for them, and then found out the benefits were smaller than they expected, or were being taxed away in ways nobody explained to them, or were being quietly offset by rules with complicated names that nobody sat down and walked them through. That is what this channel is here to change. You deserve to understand exactly what you have coming to you. You deserve to know when the rules have changed in your favor and when they have not. You deserve clear, honest information delivered by someone who actually cares whether you end up better off. And that is what we try to do here every single week. So if this video gave you something useful today, I need you to do me one favor. Share it. Text the link to your brother, your sister, your neighbor, your friend from church who you know is dealing with Medicare confusion, the daughter who handles her mother's bills and does not know where to start. The more people who understand what changed and what they need to do about it, the more seniors end up with money they are owed and coverage that actually works for them. That is the whole point. Drop a comment below and tell me one thing you learned from this video that surprised you. Or tell me what question you still have, because I read the comments and your questions often become the next video. And if you have not subscribed yet, do that right now. Hit the subscribe button, ring the bell, and come back here every week because there is always something new happening with your benefits and your retirement money that we are going to break down together. This community is here for you, and so am I.